Hi, you're watching Cape Media News Conversations. I'm your host, Gabrielle Rawson, and I'm joined today by Massachusetts State Senator Julian Cyr, who represents Cape Cod, Martha's Vineyard, and Nantucket. Julian, thank you for being here.
Of course. Thank you for having me, Gabrielle.
Of course. Senator, I understand that the Massachusetts State Senate is nearing the end of its legislative session, and a number of bills relating to police reform, COVID-19, and transportation have been introduced and passed. If we can jump right in, I'd love to talk to you about the Senate's police reform bill.
Sure. So this is sort of the busiest time in the legislature. We're sort of coming to the final stretch here. So formal sessions traditionally end July 31st. I should mention, sort of before we get into police reform and transportation and healthcare and all these other things we're working on, one of the biggest things that we do in the legislature is we pass a budget. So this is the document, the value statement, right, that Massachusetts decides what we're going to spend hard-earned taxpayer dollars on, and a whole host of priorities. So we typically pass about a $43 billion budget.
Wow.
And that's been, COVID-19 has really sort of put a lot of uncertainty into our fiscal picture and into our environment. So we really are trying to still figure out what we can expect. We estimate that there's an approximate $5 billion revenue gap that we'll see in fiscal year 2021, which is the fiscal year that started July 1st. Just for some context to viewers, a $5 billion fiscal gap is about double what we saw from a revenue shortfall during the Great Recession years. So it's a quite sizable chunk of money. The uncertain part is, what is Congress and the federal government going to do? And that's currently being hashed out and worked out now. If the House's proposal, which was passed I think 6 or 8 weeks ago, was sustained, and this is all at the federal level, Massachusetts would see more than enough federal money to cover that gap. If it's what the Senate is looking at, we're probably going to see closer to $2 or $3 billion come to the state. So that's really what's going to determine what we're going to be able to do from a budgetary perspective.
Yeah.
So we've been sort of funding the government at maintenance right now. Likely that will return in August or September to take up that budget. But I just wanted to give viewers some information about the budget, because it is sort of one of the biggest, most important things we do every year.
Absolutely, and I know that will be very important news and something to bring you back to discuss, because our region in particular is very impacted financially by this crisis. So I expect
completely
more about
right, and how do we get aid and help for a whole host of professions. But let's first talk about police reform, which was something that we have gotten done. So earlier this month, the Senate passed a pretty comprehensive police reform bill. The House actually just passed it at the tail end of last week. And we're now working to reconcile these proposals. And what sort of really spurred this latest iteration of police reform is we're really trying to meet the moment of the Black Lives Matter movement. And scores of Cape Codders, myself included, took to the streets and protested, albeit with masks and some social distancing, in late May and early June, in response to the murder of George Floyd. And I think there's so much we need to do here on Cape Cod to really address structural racism. And I say structural very purposely, because we're not talking about individuals here. We're talking about structures, institutions, organizations, our culture, right? That sort of enables this racism. And so there's a whole host we've got to do, from education to housing to healthcare. But we're starting around police reform. Okay. And so what was contained in the Senate's police reform bill and largely mirrored in the House police reform bill, about 85 or 90% of the components of the bill are actually not that controversial. These are sort of long-standing ideas that have been out there around creating a certification program for police officers. Police officers essentially have to be certified, just like in Massachusetts. If you're a doctor, you've got to be registered with the Board of Registration in Medicine. If you're a CPA, you have to be licensed. If you're an architect, if you're a mental health counselor, if you're a barber, there's a myriad of things you have to be licensed or certified by the state.
Right.
So this applies that standard to police officers, which I think is something that I think over 40 states have done. We've been an outlier. And the bill restricts deadly use of force and really limits some of the practices that unfortunately we've seen, yes, outside of Massachusetts, but also here in Massachusetts. We banned facial recognition technology as it relates to law enforcement, which has been shown to be, frankly, quite racist, and really problematic to folks of color. We put in place some pretty important, long overdue reforms to the state police, which have had a number of scandals and been a pretty problematic institution, essentially with a lot of overtime fraud that's happened there. So that's sort of 85, 90% of the bill.
Mm-hmm.
But the biggest sort of controversy, at least in the Senate's debate, is about this concept called qualified immunity.
Right.
Qualified immunity is actually a creation through the courts. It was created by the Supreme Court, and it's been interpreted further. And qualified immunity essentially says that if you are a public employee, so if you're a police officer or a teacher or a firefighter, or you work for a state agency, or you work in my office, you're probably not going to be held liable when you're conducting the public's business. And that all makes all good sense.
Mm-hmm.
But what's happened through the courts and through the jurisprudence is that the pendulum on qualified immunity has just sort of swung too far.
Right.
And really what it basically means now is that, unfortunately, public employees who violate civil rights, who violate constitutional rights, are often not held liable because they're covered under qualified immunity. And so what the Senate bill does is sort of shift that pendulum back and says, hey, look, qualified immunity still applies, but if you violate someone's constitutional rights or their civil rights in the manner that George Floyd's constitutional and civil rights were violated, you're not going to be protected. You're not going to be covered. I think that's really important. That's part of meeting the moment here. I want to be clear what this isn't doing. We're not changing indemnity. So indemnity is essentially the practice that covers public employees for financial liability. So we don't change that. No one's going to lose their house over any of this. And probably in a real world application, we're not going to see, this really isn't going to affect the vast majority of either police officers or a whole host of other public employees. But we felt it was really important that we said, hey, look, when you go too far, when you violate someone's civil rights, their constitutional rights, that's just not right. And you need to be held account. And so that's what we aim to do. This was a very controversial, strong debate. Unfortunately, there was a lot of misinformation put out there about what the bills did. But at the end of the day, we passed this bill 30-7 in the Senate. That's a super majority. It was also passed in the House. We're now going to reconcile this in a conference committee and get something to the governor's desk by July 31st. So, certainly, we've got a lot more work to do. I want to be clear as well that when I talk about meeting the moment of the Black Lives Matter movement and addressing structural racism, if we just confine that work and those reforms to policing, we're sort of missing the boat, right? We've got a ton of work to do in education. We've got to look at housing, which is a huge way that racism manifests here in Cape Cod. We've got to look at our financial institutions and a whole host of things. We're just starting on police reform.
Right.
And it's something that, it's not a perfect bill, but I think broadly it's something I'm proud to have been a part of, and I'm proud that we got done.
Right. It's I know that there was a lot of pushback to this, especially locally. And it sounds to me like, you've kind of answered some of their concerns. So I don't want to spend too much more time on that. Hopefully this interview will help to kind of get some more information out there into the public so people really know what the bill does and does not do.
And what I'd say, if you visit senatorcyr.com/police reform, we've got a whole explanation of this because this stuff is complicated.
Right.
And, it's a pretty intricate piece of law. It's actually not even in statute. It's created through the courts. And there's a lot of misinformation. And it's unfortunate that I think some folks were pretty freaked out about what we were doing. But at the end of the day, the vote here was so strong. We wouldn't be passing something that put public employees broadly at such risk. It's really about just, really holding the worst of the worst accountable when they violate someone's civil rights and their constitutional rights. And that to me is very American, actually. And I'm proud that, Massachusetts is leading the way here. If we pass the limitations that are included in the Senate bill on qualified immunity, we'll be the second state in the country to do this after Colorado. So we're really trying to be a leader here in meeting the moment. But please visit senatorcyr.com/police reform, because this is a complicated topic, and good people here on both sides of this issue have had some disagreement.
Absolutely. Thank you for the clarity on that, and for giving us an update on that bill. Let's talk about COVID-19.
Mhm.
Since the start of the pandemic, you've been very proactive in identifying the unique needs of our region in terms of slowing the spread of the virus and helping people who need help, small businesses, um, employment, housing. What legislation have you and the Cape Cod legislative delegation been working on to support our region during COVID-19?
So we've been trying to do a whole host of things, everything from updating laws around how restaurants are able to conduct their business, whether they would provide, service on the street, or cocktails to go is another bill that we got done.
Mhm.
We passed really urgent, long overdue changes to make unemployment more flexible for working people. Work to really push to have this pandemic unemployment system. So, for folks who don't get a W-2 form but are paid as contract workers with 1099s, um, there's been a whole host of legislation around telehealth that we've taken up, making it easier for people to get access healthcare. So a lot of the work that we've been doing as well is around convening stakeholders and around getting a uniform message out there. So I've worked very closely with my colleagues in the legislative delegation, with the business community and the Cape Cod Chamber of Commerce, with Cape Cod Healthcare and our community health centers, with Barnstable County and others, informing the Cape Cod Reopening Task Force, which has been meeting and working since late April. And
Mhm.
we've really been trying to make sure that we're speaking with one voice as a region. Yes, to elevate concerns and region-specific issues up to the governor and to his reopening advisory board, but also to make sure that we're communicating with a uniform message.
Mhm.
Most of the people who are here on Cape Cod, especially our visitors and our seasonal residents, but also year-round folks, they tend to see this place as Cape Cod. They don't necessarily distinguish those more parochial distinctions between, say, Dennis and Yarmouth or Truro and Eastham. They see this place as Cape Cod. And so if we're not speaking with a uniform message and a uniform voice, that means it's a lot harder for the public to follow what the guidelines are, to follow the rules of the road. And so a lot of the work has been um, collaborative, elevating issues, and looking at things as disparate and diverse as early education and childcare, which has become a huge issue. Looking at how health disparities have manifested here. Black Cape Codders are 3 times more likely to have contracted COVID-19 than their white counterparts. Looking at how do we ramp up testing and access there. A whole host of kind of other challenges we've been sinking our teeth into.
Right.
So it's been a very busy time.
Well, let's talk about that. How do you view the current state of the pandemic on Cape Cod and the Commonwealth more broadly?
So I think broadly, Cape Cod and all of Massachusetts has done relatively well
Mhm.
since we came out of the surge that happened in mid-April and early May. We have been averaging on Cape Cod about 4 new cases a day on average, for about 6 weeks. And I think we've been following a broad trend, which has been positive. Um, what has been happening, particularly in the last week, is we're seeing the effects of the data is delayed, right? The testing delayed, the data, there's a window period with it. So
Right.
we're now seeing sort of the effects of the July 4th weekend, having a lot of people here, and probably the cases are low, but we're seeing a increasing trend of cases. We're not seeing a spike, but we're seeing an increasing trend. And then we're seeing specific clusters occurring. The most widely reported has been in Chatham,
Right.
which was related to a house party.
Mhm.
Um, and I think we really just want to remind people, I'm trying to remind folks, look, we've done a really good job taking personal responsibility, having broad mask compliance, following those basic rules of the road that, we all know now, right? Cover your nose and mouth when,
Right.
you're in public, stay apart from others, wash your hands, stay home if you're sick, all those things, right? And we got to keep that up. We got to stay vigilant. Really want to encourage people, look, take it outside, right? So smaller gatherings are preferable to larger gatherings.
Mhm.
Being outdoors, it's much more difficult to transmit COVID-19 when you're outdoors than you're indoors. Particularly here on Cape Cod, right? We got a lot of wind, we got a lot of sun.
Right.
It's harder, much harder for COVID-19 to be transmitted. So where we go next is really going to be determined by what all of us do.
Right.
I expect at some point we'll need to have a bit of a retreat here. I expect there will be a second surge that comes with flu season. But we really want to be vigilant here and keep up the good work.
What's your assessment of the COVID-19 testing capacity on Cape Cod? And do people have concern over the recent increases in cases in our region, or
So
even looking ahead to the fall?
yeah, I mean, so folks are rightly very concerned, and we should be very concerned and vigilant about essentially about COVID-19 until we have a vaccine.
Mhm.
I think when it comes to testing, we've worked really hard to really ramp up our capacity for testing, and we've done a good job on the capacity piece. We secured as a delegation $550,000 for to do COVID-19 testing across Barnstable County, right? So here on Cape Cod, my brand new colleague Sue Moran, who represents the Upper Cape and Plymouth, she actually led on that amendment. Did a terrific job there. She's hit the ground running. She's wonderful. The challenge now is twofold. One is around the turnaround of tests. So the the turnaround time, particularly for serum draws, a blood draw, can be 6, 7, 8 days to get results. If you're someone who is maybe a waiter who thinks that you've been exposed at work, or is a caregiver and is wondering, if you can go and visit your elderly mother, waiting 6, 7, 8 days
Mhm.
isn't very helpful. The
Sure.
other issue we're seeing is a supply chain issue, so that we're really struggling to get, we've got the equipment to run this testing. Cape Cod Healthcare has equipment to run this testing, to run quite a few tests. The challenge is about getting the kits, the materials to actually run those tests. And in many cases, they're back ordered by several months. So we've really ramped up our capacity to provide testing, but the turnaround time in the test results needs to be improved, and the supply chain issues are very real.
Got it. What do you think the Commonwealth has done well during the reopening process? I mean, obviously, we are in phase 3 right now. There's a lot of speculation as to when or if we will ever get to stage 4. But what challenges do you anticipate as we wade further into the pandemic?
So I think it's very clear that we won't move into phase 4 until really there's a vaccine, or there's a cure. And I think the governor has been pretty clear about that. And I agree with that assessment. Um, I think that what we did first very well was our surge capacity with hospitals. Nowhere in Massachusetts, including here on Cape Cod, ever came close to being at capacity in our hospitals and our ICU units. That is a huge testament to our hospitals and healthcare systems. Cape Cod Hospital and Cape Cod Healthcare did phenomenal work
Mhm.
to really meet the moment. That was incredible. I think that we've done a good job around public communication. I think there's broad compliance. Probably people know what they need to do.
Mhm.
There's been some spots that we didn't do such a good job on. Nursing homes, I think, is one. If you look at deaths from COVID-19 here on Cape Cod, 65% of the deaths are people who are living in nursing homes.
Mhm.
And actually, we knew this would be a problem, or we should have known this was going to be a real challenge, because the first outbreak in the country was actually a nursing home in Washington State.
Mhm.
So I think there's been some pieces there that haven't been ideal. And I think there's some, I've got other critiques, but broadly, I think we've done a good job. And I really feel that the work that I need to do is to be a very consistent communicator to Cape Codders, whether they be, year-round folks or visitors, to make sure they understand what they need to do. There's a real consistent message on how they keep themselves and everyone else safe.
Yeah. Do you think that we're making improvements in terms of protecting those in long-term home health care?
Yes, I think there's a lot of lessons that have been learned around skilled nursing facilities, nursing homes. Broadly, these facilities are designed actually to be quite social, right? You're trying to provide opportunities for people to connect and to eat together and to have activities. And so
Right.
the physical plant of these nursing homes can lend itself to uh, pretty quick spread of COVID-19. What
Right.
we're trying to figure out now, and I'm doing this work as one of the bills that was passed in the legislature and signed into law, was a data bill around collecting more information about data, certainly health disparities as it relates to race and ethnicity, but also looking at the needs of older adults, and especially those in congregate care settings like nursing homes. I'm an appointee to that task force, and what we're trying to do now is figure out how do we make some progress and some policy change that's going to keep people safe, particularly in surge 2 as we go into the winter and into the fall.
Great. Well, I look forward to hearing more about that. Now, obviously, a big topic in local news right now for Massachusetts and especially Cape Cod are the new travel guidelines that Governor Baker issued. What can you tell us about this emergency legislation, and how easy or difficult do you think it will be to enforce it?
So this is actually an executive order, so it's not legislative. It's under the governor's authority, and it's a real, broadly, it's a continuation of the policy that was established that essentially said, look, if you're traveling from a state that has similar trends as Massachusetts, right, where we're seeing sort of a plateau or a decline in COVID-19 cases, then you can travel here. And if you're coming from a state that is seeing, that is in the midst of the pandemic or is seeing an increase in cases, then if you travel here, we really want you to do a 14-day quarantine. What the updated guidance basically says is that it allows a mechanism for, if someone gets a COVID-19 test within 72 hours of traveling to the state, then they don't have to adhere to that 14-day quarantine. And so it basically provides some more mechanisms and more clarity, I think, about how people can actually travel to the state.
Right.
The states that are exempt are where the vast majority of our visitors come from. So it's the New England states, including Massachusetts, New York, and New Jersey. 59% of 59% of our visitors to Cape Cod come from New England states, including Massachusetts, and then 21% of our visitors come from New York and New Jersey. So broadly, I think the people who are coming here are coming from states that see similar trends. Certainly, though, in a global pandemic, right, travel is how COVID-19 spread so quickly in the first place. And so, we've got to be vigilant about that.
I mean, if it's essentially based on the honor system, do you think it will be effective at all? Do you think it will help slow the spread?
So what the latest component of the governor's executive order actually adds fines for noncompliance,
right?
And I think it provides a much clearer sort of way for folks to say, all right, I'm able to travel and not do a 14-day quarantine if I meet, if I'm tested, if I can meet that criteria. So I actually find it provides more clarity. In the beginning, when we went into phase 2 of reopening on June 8th, and leisure accommodations, were allowed to reopen. So hotels and motels and rentals. The travel advisor we had at the time basically just said, hey, Massachusetts has a 14-day quarantine, but it's not enforced. And that put particularly people on the front lines of the service industry, right? The person who's picking up the phone
right.
At a hotel or a motel, right? Or the person who's emailing about the Airbnb rental in this very awkward position of saying, well, we have a travel advisory, but it's not enforced, so you can maybe cut. I actually think the current policy we have that the governor executed makes more sense. I think it'll keep people, it gives much more clarity around what people need to do. And I think clear, consistent information is what's most important in the pandemic. So people can know what they can do to keep themselves safe, their family safe, and everyone else safe.
Absolutely. Let's talk about the transportation bond bill. In July, the Senate passed a $17 billion bill to help fund transportation projects throughout the state. What can you tell us about it?
So this is an authorization for us to make long overdue transportation, investments in our transportation infrastructure, which here in Massachusetts are long overdue. We're not the best in the country, certainly when it comes to our transportation infrastructure. Cape Codders know that when you're driving around. Probably the most important thing that came out of this bill was $350 million for the bridge projects. So the Cape Cod Canal bridges, the Sagamore, the Bourne Bridge. There's been an agreement reached by the Army Corps of Engineers to replace those bridges. MassDOT's going to work with them collaboratively to do just that. So this $350 million is a big deal. I was able to secure an additional $7.5 million to upgrade our park and ride, the park and ride that we have at exit 6, to look at potentially a new park and ride at exit 2 in Sandwich. I hear a lot from constituents about that these park and ride facilities are just don't have enough capacity. We got a little bit of a problem with people who maybe park there not just for a few days or a week, but a month, 2 months for the winter. So that $7.5 million is going to make a real difference. I mean, I know this personally. I haven't been doing a lot of commuting to Boston recently, of course, with social distancing, but but usually, you know, I'm always driving up there. I meet my district director. He tries to park his car in exit 6 parking lot, and
Yeah.
inevitably there isn't any space. We got to drive to the Sagamore Bridge. So hopefully that'll make a difference. But I'm really encouraged to see where we're going on these bridges. It's moving faster than I expected. I didn't expect we'd have potentially new bridges by the middle of this decade. So that's encouraging.
Wow, that is encouraging. Well, thank you so much for being on the show. I always ask you, if people want to get in touch with you, how can they reach you?
So first of all, please do not be shy about reaching out to me. It's really the way that I keep my pulse on what's going on, and it's basically my job to make sure that people get help. And people need a lot of help right now because this is a really difficult time, and I fear that the coming fall and the winter is going to be even more challenging. So if you got a constituent concern, an issue you need us to look into, reach out to my office. You can call 617-722-1570. You can email me directly at julian.cyr@masenate.gov. And then if you got questions about reopening and the reopening task force, visit reopeningcapecod.org. You can get all the information on the Cape Cod Reopening Task Force. It's all there, so check that out as well.
Wonderful. Well, as always, thank you so much for your work. Thank you for coming on the show and for keeping us updated. I really appreciate it.
My pleasure, Gabby. Good to see you, and I look forward to when we can do this in person again.
So do I. Thank you.